The children's mental health quest has started. The viewer conducted a survey on the impact of COVID-19 on children's mental health.
Here, we will summarize. Child and adolescent psychiatrists want to convey regarding children's mental health, how COVID-19 affected the medical practice of child and adolescent psychiatry.
An investigation on COVID-19 and children's mental health was commenced.
The sense of being closed off socially and the unpredictable uncertainty caused by COVID-19 has been pointed out to increase children's feelings of loneliness and anxiety. With all the instructions to stay at home, it was a time when we could not easily visit friends' homes, and there were children unable to see their friends, increasing their sense of isolation. Parents themselves were uncertain about their future way of living and may have not been able to make time for raising children. This is still true in 2022. Due to COVID-19, both parents and children were together at home for some households, which was pointed out as causing harm to children, such as through neglect or abuse. There was also concern that the detection of abuse could be delayed due to the distance created between society and households to prevent infection. In the United Kingdom, although alcohol sales reportedly increased by 20% during the national lockdown, the risks to children from issues such as parental alcoholism should also be highlighted, because purchased alcohol was ultimately consumed at home. Normally, families have a role as a safety net in that if a child has issues at school, the family becomes aware of changes in the child. But if the problem at home worsens, they may not notice any changes. Outside the home as well, there were fewer opportunities for people to have face-to-face consultations and to be examined at various places, such as schools and hospitals, due to the need to prevent infections. As the ongoing COVID-19 pandemic comes to an end, the issue of child abuse may become more apparent, and children who endured the helplessness of not being noticed by anyone under the COVID-19 pandemic may need to be cared for. This is why adults must accept and understand the concerns that children have even during an epidemic. This is because children spend their days voluntarily keeping to themselves to protect adults who are more likely to get severe infections. This is to point out that adults should never forget to thank their children. In child and adolescent psychiatry, the number of outpatients decreased during the spread of infection, especially around the first and second waves. The number of patients seen for the first time at outpatient departments also decreased because people were hesitant to go out during school closures at the same time, and the stress was reduced for children with issues going to school. However, after schools were reopened, requests to see a doctor increased rapidly. The current trends will be presented in a separate video.
An investigation on how pharmacotherapy should be handled during the COVID-19 pandemic was commenced.
For COVID-19 and the handling of pharmacotherapy, the European ADHD Guideline Group stated that increasing the amount of prescription medications to children to manage the stress of having to practice self-restraint and stay at home should be avoided. Appropriate monitoring is essential after medications are prescribed. However, in the context of an epidemic, the risk of being infected from performing evaluations of a newly started pharmacotherapy in person should be considered greater than the benefits of being able to perform monitoring.
In particular, in the field of child and adolescent psychiatry, where there are few medications that have been confirmed to be safe and effective, the non-urgent use of medications should be postponed until regular face-to-face consultations can be resumed.
After carefully considering the benefits and risks of pharmacotherapy, if pharmacotherapy is still considered needed, a strategy such as online examinations should be implemented, although only at limited medical institutions. If there are already medications being taken, recommend blood pressure and heart rate monitoring with a home sphygmomanometer. If children and their guardians notice cardiovascular symptoms such as chest pain, prolonged heart palpitations, difficulty breathing, or other suspicious symptoms, immediately telling the attending physician is important.
A lesson on how to interact with games has commenced.
Although this is an issue that has existed before the spread of infection, internet dependence and video game disorders are also serious issues in children.
With the COVID-19 pandemic, there were children and adults who became addicted to games, and game devices being difficult to get due to supply shortages and game companies seeing substantial profits were reported in the news. In order to reduce a child's screen time, or time spent watching television or looking at a smartphone screen, techniques such as creating rules for using the internet and reducing the parent's screen time too are important. While the world of games fosters a strong sense of togetherness with peers who share common interests, there are times when we cannot easily escape in order to value interpersonal relationships with people around us. Children, especially those who have stumbled or have been hurt in the real world, may value a sense of belonging in the video game world. Children live with numerous forms of stresses, including at school and in relationships with friends and family. By playing games or using SNS when feeling anxious or depressed, they gain resolution and continue on with life. Not to mention, it is not surprising that the amount of time spent playing games would increase when having to stay at home or schools are closed, since there are few ways to relieve stress. And this is a normal response for some children. Over time, games can lead to disruptions in lifestyle rhythms, including sleeping during the day and staying awake at night, getting headaches, tired, having poor physical condition, poor vision, and low motivation, as well as feeling frustration, neglecting school or other hobbies, and losing interactions with friends and family outside the gaming world. Clinicians should look for ways to foster productive interactions with games and the internet, such as having parents and children learn healthy sleep habits together. Avoid forcing them to quit or increasing the dose of medications they are already taking to handle this.
A lesson on the dilemmas with child and adolescent psychiatric care has commenced.
If a child has been struggling with prolonged developmental issues, a therapeutic environment may be needed to compensate for the lack of peer group interactions and to support the child's social development. If a mental disorder is hidden in the background and more specialized treatment is needed, admission to a child and adolescent psychiatric unit may need to be considered. At the Child and Adolescent Psychiatric Ward at our hospital, which is an open ward, group activity therapy such as camps and excursions have been used to help children build peer groups through social experiences. However, with having to prevent infection, it is becoming difficult to utilize these group cohesiveness and change over time tactics. Even under the novel coronavirus pandemic, adults need to work together with children to come up with ways to work with the ambivalence unique to adolescents through peer groups and to make good use of group activity therapy in inpatient treatment.
The viewer learned about COVID-19 and children's mental health and the magnitude of its psychosocial impact. The viewer has now reached level 4.